Sever's disease, also known as calcaneal apophysitis, is the most common cause of heel pain in physically active children and adolescents. It occurs when repetitive stress and tension from the Achilles tendon irritate the growth plate in the heel. This condition is especially prevalent during growth spurts, typically affecting boys aged 8-15 and girls aged 7-12. Children who participate in sports or have risk factors like high BMI, flat feet, or tight calf muscles are more susceptible. Recognizing the early signs and understanding the underlying causes are crucial for effective management and a quick return to activity. Children with Sever's disease often complain of aching, burning, or sharp pain at the back of the heel, especially during or after physical activity. The pain may worsen with running or jumping and can be reproduced during a one-leg heel rise test or squeeze test. Diagnosis is usually clinical, based on history and physical examination, but imaging like X-rays or MRI may be used to rule out other conditions if symptoms are severe or one-sided. Early and accurate diagnosis helps prevent prolonged discomfort and unnecessary treatments. It's important to distinguish Sever's disease from other causes of heel pain in children. Conditions such as Achilles tendinopathy, plantar fasciitis, bone cysts, tumors, retrocalcanal bursitis, and systemic diseases like juvenile idiopathic arthritis can present with similar symptoms. A thorough clinical evaluation, including specific tests and sometimes imaging, ensures the correct diagnosis and avoids unnecessary intervention. Understanding these differences helps guide appropriate treatment and reassures families about the benign nature of Sever's disease. Several intrinsic and extrinsic risk factors contribute to the development of Sever's disease. Limited ankle dorsiflexion, high plantar pressures, foot malalignment, and high BMI are key intrinsic factors. Extrinsic factors include increased frequency and intensity of sports, especially after periods of rest and the use of unsupportive footwear. Recognizing these risk factors allows for early intervention and targeted prevention strategies, reducing the likelihood of recurrence and prolonged symptoms in young athletes. Sever's disease can significantly affect a child's quality of life, limiting participation in sports and daily activities. Both children and parents may perceive the impact differently, with parents often reporting greater concern. Over time, with appropriate treatment, these perceptions tend to align as symptoms improve. Addressing both the physical and emotional aspects of the condition is essential for comprehensive care and optimal recovery. Conservative management is the mainstay of treatment for Sever's disease. The primary goals are to relieve pain, restore function, and enable a safe return to activity. Interventions include rest, activity modification, physical therapy, custom or prefabricated orthotics, heel lifts, NSAIDs, cryotherapy, and proper footwear. Education of parents, coaches, and young athletes is also vital to ensure early recognition and adherence to treatment protocol. Tiered approach to treatment helps prioritize interventions based on evidence and effectiveness. Tier 1 includes custom-made foot orthoses and physical therapy, which have the strongest support for pain relief and functional improvement. Tier 2 consists of adjunctive therapies like heel lifts, kinesio tapping, and supportive footwear. Tier 3 features emerging treatments such as extracorporeal shockwave therapy (ESWT), while Tier 4 lists options not recommended due to limited evidence, such as off-the-shelf orthoses. Custom-made foot orthoses are a cornerstone of Sever's disease management. Studies show they significantly reduce pain, up to 68.6% on the VAS, and improve biomechanical alignment, outperforming off-the-shelf heel lifts. These orthoses are tailored to the individual's foot, providing optimal support and pressure distribution. Novel techniques such as vacuum forming on the non-load-bearing foot further enhance comfort and adaptation, making custom orthoses a preferred first-line treatment. Physical therapy, especially heel cord stretching and dorsiflexion strengthening, is highly effective for Sever's disease. These exercises target tight calf muscles and improve ankle flexibility, addressing key risk factors. When combined with orthotics, physical therapy enables most children to return to sports within 2 months. Supervised eccentric exercise programs and home exercise routines both contribute to pain relief and functional restoration, making physical therapy a vital part of conservative management. Nonsteroidal anti-inflammatory drugs, NSAIDs, and cryotherapy are effective for managing acute pain and inflammation in Sever's disease. These interventions provide quick symptom relief, allowing children to remain comfortable during the early stages of treatment. While they do not address the underlying biomechanical issues, NSAIDs and cryotherapy are valuable adjuncts, especially when pain is severe or limits participation in therapy. Heel lifts and heel cups are commonly used to provide short-term pain relief in Sever's disease. They work by reducing tension on the Achilles tendon and cushioning the heel during activity. Studies show that while heel lifts can improve function and satisfaction in the first 1 to 2 months, their long-term benefits are limited compared to custom orthoses. Heel cups such as Achilles Cheetah and the X-Brace have also demonstrated effectiveness, especially in barefoot athletes. Kinesio tapping is a supportive therapy that can enhance foot function in children with Sever's disease. While its effect on pain relief is similar to placebo, kinesio tapping has been shown to improve ankle and foot function, making it a useful adjunct to other treatments. It is safe, easy to apply, and can be combined with physical therapy or orthotics for added benefit, especially in athletic children. Proper footwear plays a supportive role in managing Sever's disease. Shoes with good heel support and cushioning help reduce stress on the growth plate and complement other treatments. While footwear alone is not sufficient for long-term management, it is an important part of a comprehensive approach, especially when combined with orthotics and physical therapy. Extracorporeal shockwave therapy (ESWT) is an emerging non-invasive treatment for Sever's disease. Early studies show promising results with rapid pain relief and a median return to playtime of just 2 weeks. However, the evidence is still limited due to small sample sizes, and more research is needed to confirm its long-term safety and effectiveness, especially in growing children. Some treatments, such as off-the-shelf orthoses and non-standard medications like indomethacin, are not recommended for Sever's disease. Studies consistently show that custom-made orthoses provide superior pain relief and functional improvement compared to generic options. Similarly, medications outside of standard NSAIDs have not demonstrated significant benefits and may carry unnecessary risks. With appropriate conservative management, most children with Sever's disease can return to their chosen sports within 2 months. The recovery timeline may be longer in cases with bilateral involvement or recurrence. Monitoring progress and adjusting treatment as needed ensures a safe and effective return to activity, minimizing the risk of future episodes. Preventing Sever's disease involves addressing modifiable risk factors. Encouraging regular stretching, maintaining a healthy weight using supportive footwear, and gradually increasing sports activity after rest periods can help reduce the risk. Educating parents, coaches, and young athletes about early symptoms and the importance of proper warm-up routines is also key to prevention. Despite encouraging results, current research on Sever's disease is limited by small sample sizes, heterogeneous study designs, and inconsistent long-term outcome reporting. Most evidence is of low to moderate certainty, highlighting the need for larger, high-quality randomized controlled trials. Addressing these gaps will help standardize treatment protocols and improve outcomes for affected children. Optimize care for Sever's disease. A multicenter randomized controlled trial with a large cohort and long-term follow-up is recommended. Such research would compare the effectiveness of custom orthoses, physical therapy, and ESWT over 12 months, providing robust evidence to refine the tiered treatment framework and guide clinical decision-making. Summary: conservative treatments are highly effective for managing Sever's disease, with custom-made foot orthoses and physical therapy as first-line options. Adjunctive therapies like heel lifts, kinesio tapping, and supportive footwear offer additional benefits, while emerging treatments like ESWT show promise for the future. Early recognition, individualized care, and ongoing research are essential for optimal outcomes. For families dealing with Sever's disease, the outlook is positive. With proper conservative management, most children experience significant pain relief and a full return to activity. Staying informed, following recommended treatments, and maintaining open communication with healthcare providers will ensure the best possible recovery and long-term foot health for young athletes.